Okay, welcome everybody. Thank you for being here in attendance for today's webinar as part of our ongoing webinar series. My name is Joe Simonetti. I'm an addiction medicine physician and I'm the Director of Education for the Firearm Injury Prevention Initiative at the CU Anschutz Medical Campus, an initiative where we work collaboratively with researchers, educators, public health professionals to further the mission of firearm injury prevention. I'm really excited to be here with our speakers today. Before we transition to the talk, I do just want to say that the chat dialogue for this webinar is actually closed. All questions you can place through the question and answer chat box at the bottom. It may be the case that our presenters will respond to those questions live through their presentation. It might be the case that we respond to them in text through the chat box, through the Q&A chat box. We will have some time for question and answer at the end. And so if we don't get to respond to your question while they're presenting, we will try and get to it as best we can at the end. With that in mind, I am going to transition very quickly over to our presenters here today who are presenting on healing the hurt on both sides of the gun, lived experience of gun violence in an urban center in the Rocky Mountain West of the United States. Thank you all. I'll leave it to you.
Thank you, Dr. Simonetti, and thank you to everyone who is in attendance today. My name is Johnnie McCarthy, and I am an assistant professor in the Department of Surgery and faculty through the Firearm Injury Prevention Initiative. And I run our REACH clinic at Denver Youth Program, which we'll hear a little bit more about. And I'll pass the intro over to Johnnie Williams.
Hello, everyone. Again, welcome and thank you for joining us. My name is Johnnie Williams. I am the Executive Director of Denver Youth Program. I've been doing this work for many years. I started out as one of Denver's first violence prevention specialists and bedside intervention specialists, also violence interrupters. I am now the director of the work that we're leading here in our GBI system in Denver, Colorado. Happy to be here.
Dr. Myers, you want to go next?
Sure. Hi, my name is Quintin Myers. I'm an assistant professor in the Department of Surgery at CU, and I am also the evaluator of the At-Risk Intervention and Mentoring Program, which is the hospital-based violence intervention program associated with Denver Youth Program.
Dr. Lee.
I'm Ben Lee. Thanks for everybody's time and attendance. I'm an emergency medicine physician at Denver Health and have the privilege of being the medical director of Denver Health's AIM program. And I'm also an assistant professor in the Department of Emergency Medicine of CU.
Thank you so much. And we'll introduce our other members of the research team as we go. Some people might be joining us here in a minute as well. So it's not a good presentation unless you have a fluid arrival time for presenters. So we will avail you of that. And then before we move forward, I think it'd be good for Johnnie to give a little bit of a background of Denver Youth Program and those different initiatives in that bottom left corner.
Thank you, Jenny. Yeah, definitely. So Denver Youth Program was known as Metro Denver Partners one-on-one mentoring program, came out of the diversion office about 52 years ago, where the diversion office knew that there needed to be something done. And what they started out with was having a senior partner, junior partner type of relationship with officers of the court were actually who they started out with, and that was a great model. And we've been providing young people with one-on-one mentoring, junior partner, senior partner, TAL relationships 3 hours a week for over 50 years now. And out of that grew the GRASP program, GRASP Gang Rescue Support Project. There was a lot of violence happening in the community. And again, one of the police officers that were working with the program just went to the young people in the community that he was making constant contact with and asked them, like, you know, either let's sit down and talk about like what's going on in the streets, or show me where to pick up the next body. And they didn't listen at first. And initially, they didn't want to hear what the police officer had to say. But truly enough, there was another shooting and another young person lost their lives. And at that particular point, they thought maybe we should talk to someone. And they started the GRASP group. And it's a support group that was happening every week on Thursdays. And 33 years later, we're still having that group, that support group every Thursday night to talk with young people, not about gang lifestyle, but about like, what are your gifts? What is your baggage? What are the things that drive you every week to make decisions that might cost you your life? And out of that, we had a relationship with Denver Health, and that relationship with Denver Health in the community was getting kind of strained at points. And Denver Health wanted to know what the community's issue with Denver General at the time was. So we let the community tell them. And it was a lot of disconnect and broken trust in that system at that particular time. So what happened from there grew a program, at-risk intervention and mentoring, which is a bedside intervention program where we respond bedside as a part of the care team to young people who've been traumatically injured in the community, either via gunshot, stabbing, or assault. And we make sure that we're lifting up some of the things that they may be dealing with. And that is the AIM program. Out of that, we also wanted to know how we can support our young people to make sure that they're making better choices in their life. So from that, they told us that they need a job. And we decided that we needed to do a social enterprise because some of the skills that they've learned from their lived experience did not allow them to have good job work ethic. So we started Grasp Enterprises to teach them good job work ethic. And we've been very successful at presenting them with soft skills and very intentional skills around making garments. And Grasp Enterprises handles that piece of it. Then the Hummingbird Initiative is an initiative where we are, having young people who are interested in doing work in the medical field and giving them a pipeline, actual position that they can actually be able to go into the field, because sometimes the pathway does not show that they have the ability to get into the field. But we wanted to give them the avenue to do that. So they shadow the doctors. They're able to learn stop the bleed, CPR, and other, nursing trades that they might need to be able to introduce them to the field. The My Outdoor Colorado program is getting our young people out of the community and getting them into the outdoors, whether it be for skiing or snowboarding or mountain climbing or rock climbing, whatever the case may be. It allows them the opportunity to get away from the things that they're dealing with on a weekly basis and getting them out into the community to where they can be able to share the outdoor experiences. So those are some of our programs and our initiatives that we keep our CDI system going, and we definitely have the ability to engage with our young people in some of the best ways that be able to introduce their lives.
And to talk just a little bit about the partnership as well, you see all of these logos, and we're very privileged to have an AIM program that serves these different hospitals and partners with these different hospitals. And so in the world of hospital-based violence intervention programs, the AIM program is a hybrid program. I always say hospital linked, a hybrid program, because we do have this deep embeddedness in the hospital and healthcare system. The AIM team is fortunate to really feel incorporated on the best of days, feel incorporated into the healthcare team. And that's the goal of every healthcare encounter, is that the AIM team responds within that hour window when someone has been injured. And we have a variety of alert mechanisms in place. And then that healthcare takes off from there, and that the violence prevention professional through the AIM program becomes this liaison of care. So I promise every slide won't be this long. I do want to take a pause really quickly and have Dr. Velopulos and Erica Green introduce themselves.
Hello, everybody. Happy Tuesday. Happy Tuesday. I'm Erica. I am the program manager for the AIM program here at DYP. Thank you guys so much for giving us this time to present to you guys.
Hi, I'm Dr. Velopulos. I'm a trauma surgeon and health services researcher and the medical director for AIM at University Hospital.
Make sure no one else is signed on. Okay, so that's our team that you're going to be hearing from today. And we're going to take this opportunity to walk you through this specific research project, the Healing Both Sides of the Gun. But we also want to take a moment to give you a little background on the research team that completed this research project, because that is an important part to making sense of these results.
So as we're doing this presentation today, you're going to see some words, or you hear us speak words, and you may know them. I'm not sure what everyone's background is, but when we talk about intervention and interruptions, I had just mentioned a moment ago that I was one of the first violence interrupters and intervention specialists, credible messengers. that term is used interchangeably with VPP. And you know about trauma-informed care. We do those trainings. A bedside responder, that's what our VPPs are doing. The Reach Clinic in the brick box, that's some of the work that we do here at our post-discharge wound care clinic that we're sitting in now. Hospital-based violence interruption, that was the network that Jeannie was just talking about, other hospital-based intervention programs coming together. And community safety, naturally, that's a self-explanatory. In the case management that we do around all of that, lived experience is just someone who has had some type of experience in the community, whether it be from gangs, violence, drug use, whatever the situation that brought them through some of the traumas that they witnessed as a young person, and it changed and it helped mold who they are as an adult. But it could be something that they can tap into to help our young people to move forward in a pro-social positive way.
I'm having some slide technical issues here, so thank you for bearing with us in the Zoom process here, but both the Zoom and the Zoom. Just a moment to talk about the research team, and I want to talk just for a minute about how this project started. The research team is comprised, as you can see, predominantly of violence prevention professionals, and those are the VPPs there, that acronym. The asterisk there on the side is a VPP researcher. Those of us who do not have asterisks are not VPP researchers. We are quote unquote traditional academic researchers. And then Monica Williams is our exception. She has that tilde next to her name. She is from the community of violence prevention specialist, which is the S at the end of her acronym, but she also has an MPH and is a trained professional in research, but also in community-based research. So just to tell you who's in the room and what that looks like in terms of our research initiatives. So I'll pass it over to Dr. Lee first, I believe, for why this research team matters, and other members of the team will also weigh in on this slide.
I first want to say that what Ginny is doing in her qualitative training of our VPPs as researchers, nobody else is doing any of this work across the country. It is truly innovative, but more importantly, it's meaningful and impactful, not just for our team, but for myself as a clinician first and a researcher second. I can see the translation to the bedside in not just amplifying the voices, but giving a voice in the first place to our patients, our clients, our victims of violence in the community that otherwise don't have one. And you can see the impact that the professionalization of this work of our team and how that translates to their bedside care of victims of violence at their worst moments is just some of the most amazing type of work that I have been fortunate to be a part of. And so I have to give all the credit in the world to Ginny and Johnnie and the work that they've done with our team. And I'm just very excited to see how this work continues to expand locally, regionally, but also across the country. I think just speaking to this slide, I mean, as many of us know, especially in firearm research, there have been many barriers throughout the years. I mean, we lost a generation of funding for impactful research with the Dickey Amendment. And so folks in the community have been doing this work for years and years, but there's been no true research funding from a federal level to be able to provide evidence. And so from a research standpoint, we are just catching up to the type of work that has been done. And we are trying to both quantitatively, but also qualitatively interpret those results. And I would say that from a traditional research standpoint, if we're talking about the, say, gold standard of quantitative research and randomized controlled trials, we found through trials and tribulations that for this type of work in community violence intervention and prevention, hospital-based violence intervention, that a lot of these studies, their designs are not ethical and not providing the same types of resources for individuals who have been victims of violence that are available. There are many, not just ethical, but moral concerns around that. And so those are some of the challenges that we and others have faced in trying to measure, say, traditional effectiveness quantitatively in this type of work. And so that just highlights the need for additional qualitative research, again, in giving voice to those who have been suppressed and ignored for so long, especially our youth and our victims of community violence. And I'll stop there.
And so, just to expand on what Dr. Lee is saying here too, when we talk about interpersonal community violence, traditional research has really focused on, in part because of funding challenges, has really focused on the quantitative. And so we are in need of more qualitative research because what we're missing when it's purely quantitative is we're missing what it looks like from a lived experience. How do people actually understand, experience, and engage with community violence? Moreover, it's important to recognize that it's not just those who have survived violence. It's not just those who have been killed from violence, but it's those who are engaging in violence. We need to understand why that's happening too. And traditionally, qualitatively or quantitatively, there's been a lack of that in the research, in part because the traditions in especially criminology, sociology, those sorts of things, we tend to label participants and individuals who participate or don't participate in violence. And it's not a binary. A lot of times it is a both and situation. And so it's a need to understand that. And I'll let the team talk more about that in a little bit. But just to say that we need more qualitative evidence. And the natural next step is for the VPPs to truly lead it, because again, I want to echo what Dr. Lee said about Jenny's work being extremely innovative. The traditional CBPR approach, or community-based participatory research approach, doesn't have those from the community actually lead the work. They're just part of the work. Everything is driven by the academic, and in Dr. McCarthy's paradigm here that Johnnie is wonderfully helping lead as well, it flips that and it lets those from the community actually engage and participate and create research rather than just participate. And so we'll move on to giving a little background. So gun violence in the United States, as most of you probably are aware, is a pretty important issue here. Nationally, we know that there are about 6.1 deaths per 100,000 people in the United States. Colorado actually is a little bit higher than that, and Denver even a little bit higher than that. So what we know and what's interesting is when we're actually looking at gun violence rates here, Colorado, this is data from Colorado Firearms Data Dashboard. We see that suicide attempts, specifically suicide attempts with firearms, are in this case completed suicide attempts, unfortunately, have been on the rise. In 2024, there were 710. So that's not great. And even worse than that, we see this spike around 2022 of the purple line that's in the middle there of interpersonal violence and interpersonal homicide. Luckily, we've seen that declining, but that's not true for the entirety of Colorado. When we look at Denver specifically, and I think I might be jumping ahead a couple slides here. Yeah, so in Denver specifically, we actually see firearm homicide rates as significantly higher than Colorado generally. And one thing I want to mention again, and this goes back to the issues with traditional research and the way we traditionally measure firearm related harms, these are all death patterns. We're only looking at those who have actually passed away due to firearm violence. And the limitation with that is what happens to all of the individuals who have experienced gun violence but haven't passed away? What is their lived experience? What do those numbers look like? And the simple fact of the matter is it becomes almost impossible to do that until we engage people who are from the community and can actually engage those who have participated in and those who have just been victims of firearm violence. And so with that, I think I'll pass it back on to our team.
Thank you, Dr. Myers. I appreciate that. I just wanted to, piggyback on one of the things that he talked about with the project that Jenny is doing and the wonderful work that she's doing with training the team and allowing the team to have a voice. I'm pushing back on that a little bit because the way that this happened, there was no choice from my standpoint. Jenny came to me and asked me if the team could do research one time. Could they be subjects on a research project? And I said no. In fact, I said hell no, because we've done it time and time again. Researchers come into our community, ask us a bunch of questions, and we don't know what happens to it. And Jenny was shocked and awed. I almost left in a very disgruntledly, but came back and said, well, why don't we do it differently? And I listened to her to see, like, what do you mean by do it differently? Why don't we make the team the researchers? I was intrigued by that. And then we went through making sure it's feasible. How can we turn a team of VPP specialists who already have quite a load of work to do into researchers? How do I get them interested in research, right? Research is a very special discipline that people have to learn a lot to go into, and our team's not going to want to do that. So Jenny was able to create through her dissertation a way to present research in bite-sized pieces to where it could be absorbed in a way to see how we can ask questions and then do code books and create themes and all of the aspects of research on a project that was important to us. And after that, it became a no-brainer. It became something that we were interested in, not only because oftentimes our community are the subjects of said research, but let me give you an example about this project and how this project came about. The mayor's office called me and asked me if they could use our young people and research subjects and ask them, why do they carry guns? I said, absolutely not. We're not doing that. I said, but my team can do it. Let me give you a quick example about the difference. Some person, often white, comes into our community and says, hey, Johnny, can you tell me why you carry a gun? I'm like, what? Sure, I can tell you. I never carry a gun, sir. I don't know what you're talking about. I'm not that type of guy. I'm a very nice guy, right? Because I don't know where he's going with this information. I don't know what he's going to do with this information. I don't trust. We keep talking about the broken trust. I don't trust where this information is going. It may be going into an investigation. The police are going to come knock on my door. That's how our community normally responds to those types of questions. But if Ryan, who's in the room right now, comes and talks to me, what's up, Jay? Like, what's up, Ryan? What's going down? I don't know, man. These streets is hot. There's a lot going on out in these streets, man. If everybody's walking around taking care of business, are you heavy? Bro, I'm always heavy. He asked me the same question, got the answer that he needed. But as a researcher, he knows how to translate that information into not only a qualitative, but a quantitative aspect to be put into a research project. I didn't feel like I was being researched. I didn't feel like I was being interviewed. I didn't feel like I was being questioned. We were having a conversation. And I trust that that's not going to go anywhere other than where, him and I talking about it. So now if he comes back to me and be like, look, bro, let me check this out. We got this project that we're doing, and they just need to know what the community is feeling. They need to know what's going on, and me and you going to talk. I'm going to take some of these questions. I'm going to present it in a packet. You good, I'm good, and we're going to do some research about it. I'm like, okay, bet, let's do that, right? So it's a different approach. But because Ryan has been trained in research, he knows how to exhume the information from a conversation versus me feeling like I'm under a microscope that you see on this slide right now. And he knows how to translate it so all of our wonderful researchers that are on the call right now will be able to understand what I just said in my conversation. That's why this is important. That's why it happened.
And he did say no to research until we did change that paradigm just a little bit, or a lot. I will have Ryan introduce himself here in a minute too. He stepped in. That's why Johnny Hughes. Actually, Ryan, introduce yourself, will you please? Ryan's in the house.
Good afternoon, everyone. Ryan McNeil, part of the AIM team. and the research team. Glad to be a part of the conversation as always.
Friends, violence prevention professional researcher. I think it only showed you his ear, but hopefully when he talks a little bit more, you'll see the rest of it. There we go. You'll see the rest of his face. So the methods for this project in particular, it started out as a non-research project. As Johnnie mentioned, we were asked to participate in a research project, and those data were being shared back with a different organization that isn't a part of Denver, but is located nationally in another city. And what we ended up doing was saying, these interviews on the landscape of Denver, what is the landscape of gun violence in Denver? We took this back and conducted a few interviews. So we have 4 semi-structured key informant interviews. It translated into a training experience for our team, and then also the quality improvement or quality importance that Michelle called it a quality importance project, which was great. So the quality improvement, quality importance, to be able to say, what do we need to know from these interviews? Because we too are curious. We ask a lot of the same questions. What's happening in Denver in the world of gun violence? But the answers, like Johnnie said so eloquently, the answers change based on who's asking the question and what the question is asking in terms of like the action that follows the question. So it's not just how do I answer the question, it's what do I do with the information I receive. And so this research team that is VPP dominant is actually well poised to incorporate this into our work. And we also have questions about how gun carrying and gun access has changed over time by age, by demographic, by different pieces of the equation. And so the next step, which we'll talk about, is to dive a little deeper into that for our own work and also to impact that positively in intervention, but also in prevention. So for this study, we conducted these 4 semi-structured interviews. I'll have Erica here and we'll talk a little bit more about who participated because that's actually extremely important for this conversation. We lasted about 60 minutes per interview. We had 1 VPP and 1 academic researcher in each of the 4 interviews, and they were the same team throughout. We used an inductive deductive codebook development process, so we all coded 1 transcript together. This was also used to train our second round of VPP researchers. So we had a team of seasoned VPP researchers with a team of new VPP researchers who participated in this project together. We had 5 analysts per transcript. Again, this was training, and it's also the rigor. It's a little bit excessive for the rigor necessary to code a project and to create themes based on that project, but it is this training exercise. And so everyone feels a little bit more comfortable when they have a broader group to bounce these ideas off of. We had a research meeting for 2 hours every week for a collection of weeks to produce these results. We ended up with some inductive thematic analysis, and then the excerpts that we utilized that you will see in a little bit here are the excerpts that had the highest agreement by code or by analyst. And so we'll walk you through that as we get deeper into the project.
And just to speak to the rigor, I mean, sometimes when people hear about a community-based or violence professional individual group type of research team, they think, okay, you guys can't be doing real research. It's just a novel project. But we've had traditional researchers come to our training and say when they left, like, wow, this is really in depth. This is more than I went through when I went through all of my years of training, or something that I've not thought about in many years that I learned a long time ago. But we're introducing fresh research information. So I think that was a piece I wanted to lift up, that Jenny is incorporated into this curriculum, that we're using very important research knowledge that others may not be even using anymore. And we're incorporating it with our lived experience into the work that we're doing on each of our projects.
And now we'll introduce Erica to talk a little bit about the interview participant selection, why they were selected, and some of the findings that we see incorporated through this perspective into our research.
Yeah, so through this research study, we found that trying to figure out which participants should be a part of this research study, one of the main things that needed to be present was the relationship. We needed to make sure that those who were going to be a part of these interview questions felt protected, that they felt heard, that they knew that none of this information was going to be used against them or any type of ill way. And so making sure that they felt comfortable in this space being asked these questions was very, very important. making sure that these participants were active participants. So someone or some of our participants that can speak directly to gun violence in our communities, their personal and lived experiences when it came to the gun violence in the communities, and what we were hearing from our participants was very, very important. So the ones that we chose, we knew that they had a story to tell that was very, very important, that we can get the information that was needed from these 5 participants. And the only way that we got them to do that is through the relationship building in the beginning when we met them. For me, when we were doing research, I also was with Johnnie on this, like, so what happens after? You know, I've been a part of a lot of research studies where I have asked these questions and put my heart out into these questionnaires and things like that, and I never knew where the information was going or if anybody even gave a damn about what I was talking about. And so making sure that our participants understood that this information was going to be taken very seriously, was going to be used as a form of movement of change. And I think that was how we chose those 5 participants to be in our study. Some of the things that we figured out through the lens of personal experience is the impact that they were feeling and the actions. It was important that through these questions, how we phrased it, when we went back and coded everything, these are some of the important things that came out of it. So how they were personally impacted, how these things happened. So were they shot at home? Were they the aggressor of gun violence? Did they have a family member that was shot or have died from these inflictions? And so through coding, we realized that there were just a few things that stood out the most. And also one thing that I noticed was the questions that the city was asking us to ask really didn't get down to the real answer to the gun violence, right? And so through this, I think we also learned that language is very, very important when we are trying to come up with the cause, the effect, the root cause, and all of those things of gun violence. And so as you see on your screen right here, these are some of the things that we found, some of the things that our participants expressed through this research study. And that is very, very important that we have a conversation about all of these entities that our community encounters when we are going through gun violence. So the law enforcement part of it, their experience in the hospital, what does that look like when they come back into community? Is healing a thing? Is that a conversation that they have in that space? Is that a conversation that they have with law enforcement? Is this a conversation that they're even having with their family members? So I think that through these conversations and these questions, we can dig deeper into these lived experiences and how they are living day to day these gunshots, wounds, and experiences.
And just to jump in as well, like Erica said, we'll show you the whole thematic map for the project here in a minute. But when we were going through these, we realized that we couldn't actually code the personal experiences of our interview participants with the landscape of gun violence in Denver because they were informing the perspective on the landscape. And so in and of themselves, this is the lens through which this question is answered. And so as Erica's walking through these, just to keep in mind, this is what these 4 people said to us. And some of these participants were clients, some are professionally employed in the community violence intervention and prevention landscape for CBOs and for the city. Some are working in different ways in their own family and their own personal networks. And so that lens of experience, we stepped back as we were coding these transcripts to say, wait a minute, these are not two separate data sets, but we need to tell you what the personal experience of the participants is in order to better understand what is generated through that landscape of gun violence map. So we'll show you that like I said, in just a minute, but to kind of walk you through a little bit more of what they told us through these themes. I can turn it back over to Erica and obviously Ryan and others weigh in too.
Yeah, so as you see, when we were coding this, there was a lot. I'm not even going, Brian, he's laughing because it's serious, right? Because you you want to put these things in categories, right? And you really can't categorize some of the things. You have to break it down even further. And I think that that was like one of our challenges. Like, how do we throw this into this box, right? When it deserves to be in both boxes of personal impact versus their personal experience with gun violence. And so that took us a little while to make sure that everything that we found here on the screen that our participants were saying, that we put it in the right box to code it correctly and break it down if we needed to. So we had to change some of the codes, add some, move it around a little bit, right, to really get to telling their story in a more effective way. Do you think?
I mean, absolutely. For me, when we were going through this process, and just to piggyback off of everybody participating in the conversation, but specifically Johnny and Erica, like we learn the importance of language while going down this path about research. Yes, Dr. McCarthy, like she took us through the real rigors of learning how to be researchers. She put us in many rooms with IRB and people from across the country who do this and took us to different places so we could also participate. But one of the things that we learned at the core of this was much of this research beyond the numbers was about the language and the language itself, the conversation around it, the way it was talked about by those who are research subjects and those who are doing the research itself. Like that became a large part of the conversation, even down to the way that research has been put into the internet spaces and how AI may perceive that language as well. And in knowing that language and knowing that people have
Everybody just hold on for one moment. We have a brief audio issue.
Hi there, just verifying that we can hear each other on Zoom.
Correct.
Okay,
Yes.
so it looks like it was just that one participant that it looks like we've lost.
And I think if we give them a moment, they can jump back on.
Okay. And back.
Dr. Myers, while we're waiting for everyone else to rejoin the seminar, I wanted to talk a little bit about sort of next steps in your line of work. Where do you think this is heading in terms of your individual efforts?
As far as individual efforts, I so my sort of line of research has been within this carrying space, and so we're working with the team to continue to build the research questions that they want to answer. So ultimately, the project that we're discussing today um, allowed the VPPs to have some more research questions that they were more interested in. And so we're working on finding funding so that we can actually compensate individuals for their participation in the research, as well as compensate the VPPs for their time as researchers. And so we're working on allowing them to lead the research so that we can continue to find out more about the landscape of gun carrying, both in Colorado, and then ultimately we want to expand it nationally using Dr. McCarthy's um, paradigm of VPP-led research. So that's a big area that we're going next, and sort of where I've been focusing my individual efforts at the moment is making sure that there's funding for the VPPs to continue the line of questions that they have.
Thank you. And we'll come back to Dr. McCarthy's team to let them finish up, and then Dr. Lee will come back to you.
Our next training is going to be on technology, so stay tuned for that. We're having some Wi-Fi issues. Thanks and sorry. Yeah, and I think maybe just to take us into the next lens. I mean, Ryan asks this question, and it keeps me on point all the time of what do we do with these experiences? And I think part of it was naming them and saying that these are the experiences that participants told us that happened to them, and the things that they did, the personal impact, like the actions that they took, the impact it had on them as a person, and what they did as a result in terms of feelings and actions. Also personal circumstance, what happened? How do you move forward with this? And I will turn it back over to you guys, but I just wanted to frame out a little bit too of what that movement towards healing looks like, because these again felt as a standalone topic area or standalone information that is validated through the research, but also validates the importance of the research when they answered the other questions that weren't about their experience personally, but were about generally what's happening, how do we understand the landscape of gun violence in Denver. I didn't mean to break off your train of thought.
Being able to not only identify what it was that we were looking to learn from the subjects, but equally as important is it gave us real-time knowledge about how to do our jobs better. I think that becomes one of the most important things that happen for us as a team. And to just go back briefly to what Johnnie was saying, like in the beginning of this, I was also very, very skeptical, wanting to know why people outside of our communities want to know what's happening inside our communities. It makes me feel weird, only because the idea that you'll come back and you'll help us fix those things becomes strange if you're not there on a day-to-day basis. I remember in one of these moments, just having a real epiphany as we were doing it in real time, like asking Jenny, like, so you're essentially saying that if the people who were doing this research is about will never read this, whether it's because it's not offered to them or they don't have access to it, or because they don't understand the language that is written in, then how can we honestly say that we're doing right by them? And so I think that that's why it becomes important when Johnnie is saying, well, in the beginning, I wasn't cool with this. It had to be presented in a way that said that you're not just going to leave with this and write great articles about it that put you in a better position in the world, and yet what's taking place in these neighborhoods that we say that we care about, nothing gets resolved. And so just looking at these things, the way in which we can support the system and be a collective, our different perspectives on how we can engage with the community to stop violence, interrupt that violence, stop retaliation, and all of the different things that are just connected to that. Like we can honestly say that we've circled every area of this in order to properly be effective in it, or at least that's how I feel.
Thanks, Ryan.
I would just say moving toward the healing aspect of it and going to move to the stuff and just making sure that the experiences that we have with these interviews, as you can see from those slides that we just presented on, it was a translation, as I had spoken about previously, the translation of them sharing with us their situation, their circumstances, and sometimes their pain. We had to translate that into those experiences. They didn't have any idea about initial experience and personal impact. They didn't have any idea about any of that, right? So we had to extract that to lay it out, and just being in the room sometimes and having that trust and having that connection, and with the goal of healing, with the goal of, like Ryan was saying, a dissemination with implementation, then we are able to say, this is what I felt like they were saying when they were, talking to me, and they were, referring to me in this. I can connect that to my own lived experience. I could connect it. I'll tell a quick story and then I'm going to move on. But I had to do an interview with a young man who was responsible for shooting a police officer. And all of the researchers in the community that I was working in on the academic side wanted to know, why did this person shoot a police officer? Whereas community wanted to know, why was this person not feeling safe enough to where they thought they needed to carry a weapon? Both of those were very aspects of the story. However, the young man that was involved in it had no idea to answer any of the questions from either side. All they know was that when they woke up that morning and they were heading out to the park and they got dressed, that before they walked out the door, there was a little voice in their head that said, I need to get my gun. There was no immediate threat. There was no reason. There was nothing going on. But because he was conditioned to carry that weapon with him, he grabbed that weapon. And when a fight broke out in the park and he was running for his life, it was not from the police officer. He was never intending to shoot a police officer. But because he was running for his life, the fear in him said, get the gun and just start shooting back. Never looked back, just pointed the gun back and just started shooting. And the police officer got hit. So the problem started, when I always talk about root causes, the problem started a long time before he even walked out the door that morning. But because of that, he ended up shooting a police officer, changing his life and the life of a lot of Denverites that were around that situation. How does the questions in a research project get to that? Because that's what I wanted to heal. The healing that I wanted to get to is, how do I stop another young man from walking out of his door, grabbing a weapon that could change his whole perspective of life and don't even know why they're doing it? Tell me what research question I can ask to get to that. And that's why this team is important. And that's why the trust and the experience is important. And that's why the in-depth perspective has to go beyond the questions that you're asking for a research project that, like Ryan said, many of the people will never read.
So our conversations are always very important and very lively. There's a lot of back and forth because we're really grappling with not only what do we need to know, but why do we need to know it? How do we find that out in the most respectful and appropriate way possible? And how do we carry that forward in a way that makes sense? I mean, I wasn't joking about it earlier, but I always say it in a little bit of a joking way. When Ryan says, who reads all this? And I open my Zotero library, like nobody cares. So understanding like how the team can learn real information because of that trust and experience, take that in-depth perspective back and to the community and make an impact really is something that is not otherwise available to academia. And that's why I think we're also passionate about this, is because there's an opportunity not only to understand better in a much more effective way, but to really affect change as a result. I know you can't see this very well. And to Ryan's point again, when he was like, so like, how does the community read this? And everyone's like, I think maybe we should simplify it. But to walk you through this very simply, this is our thematic map. And so initially we had our personal experience separate, and then we pulled it completely out of this map. But this is what we learned about the landscape of gun violence in Denver from our participants. You can see that this whole thing is in a backdrop of trust, which is that far left side, lacking trust in the challenges department at the top, building trust down in solutions, and those indicators of healing were the things that run across the bottom that are the foundation for all of this work. And so taking people's advice seriously, I made a graphic that is hopefully a little bit more accessible. I know that it's still a little bit confusing and benefits from unpacking this a lot, not even just a little, but a lot. And I'm sure that we'll leave no space for questions. I'm kidding. I'm sure we'll clarify all questions. There won't be a need for them at the end. But just to show you where the challenges and the solutions intersect, trust is a little bit lower in the challenges, building towards solutions and healing. You see how this impact at the individual environment and systems level is indicated here. Here you can kind of see that those themes or these sub-themes within cross some of these different lines. So you see generational trauma, for example, is indicated in individual environment and systems level challenges. Down here too, you see the redefine the charge to protect under law enforcement spans those solutions across all three levels. And so without going too far into what that looks like, I do want to share some of these quotes with you, and we can kind of bounce around and talk about them. But what we're pulling from here is individual, root cause, internal, self-relational, generational trauma. So when you see those words, you'll see an indicator or a category, individual, environment, and systems level, and then you'll see the theme, which in this instance is root cause, and you'll see the reference within the category. So just to kind of give you a little bit of the key to how these quotes will land, We're going to move kind of quickly through them. I think we'll spend the most time on root cause and a couple of other key quotes, but then we'll leave 5 minutes for questions at the end. So I do apologize that we'll be a little tight on time. But when we talked about root cause, looking at individual level responses, what is happening at the individual level? Like Johnnie said, there are other things happening that motivate gun carrying or gun access and that lead to incidents. Ego and fear were two of the primary quotes or two of the primary themes that held across participants. Literally every single participant said this, some version of this, and you can see how it impacts the individual level, but also the environment. Fear is not something that is unique to an individual, but it's felt within a certain set of circumstances. And so I'll give you a minute to read some of these. If others want to weigh in on these, we'll move through some slides of quotes.
Yeah, just lifting up the social cultural norms. And unfortunately, when I talked about why some of the young people carry, social cultural norm is if you're between the ages of 13 and 24, and some of the communities that we live in, you have to have it, and that is a misnomer, but that's something that they have incorporated within themselves. Sometimes culturally, it became something that was expected of them, not only by their peers, but some of their foes as well.
And some of the benefits of having these conversations with the VPP team is that for someone like me, who's a traditional academic researcher, I can access these quotes in different ways because the team can explain them to me. And so things like, being a white woman, white female researcher, I wouldn't necessarily call out this quote that quotes someone being a Black man because I wouldn't want to feel like I'm perpetuating a stereotype. But the team, when we had this conversation, said, no, this is actually a really important quote to include because it goes into some of that social cultural environment state, but also is expressive of lived realities that in my mind are not mine to express, but in our team's mind are important to share. And the team has the expertise and the credibility to share those experiences. So these are our themes, again, problems to overcome, easy access to guns, distrust in the healthcare system was a systems level concern and one of the problems to overcome. People are injured through violence, don't feel necessarily safe going to the hospital. We look at personal and psychological well-being, know who your people are, the mindset, who's going to be there for them really when things get really tough, who's going to show up. Mentors, safe spaces. These are not groundbreaking opportunities to learn information, but they are genuine in ways that have been accessed by the team and academic research can support, but on the one hand may not go as deep into the realities, and on the other hand doesn't have the reach to affect change like we've been talking about. You can see trust continues to show up. Law enforcement was the one theme that spanned challenges and solutions. Law enforcement was seen as a challenge. The call to serve and protect was challenged through this as a challenge. The solution is better training, cultural sensitivity, understanding where the system kind of breaks down or doesn't actually serve the purpose that people believe it to serve or it's intended to serve. Restorative justice came up as a challenge, not as a solution. I think it could be reframed as a solution, was part of where we're headed with some of these suggestions. I want everyone to take a minute to read this. Actually, we'll read it out loud. Johnnie will read it to us.
But I think another thing is just, a big part of the hurt comes from being treated like there's something wrong after somebody hurt you. So when you're dealing with this and with these kids and act as an advocate in the room to say, hey, don't talk to them like that. And when they're being interviewed by the police, a sensitivity training for those police officers is like what was known, these kids and these person, this is a kid, this is a person. Just kind of reminded them about that. I remember when that one happened too.
Yeah, and to pause for a minute and say there are so many layers, and this is where the team is present at the hospital bedside. This is where the team is present in post-discharge care. So to understand why trust gets broken down, what needs to be done to unbreak broken trust, and to build that trust and to make people know and feel and genuinely believe that they're safe and make it actually true that people are safe in different spaces. And that's part of the advocacy work that comes from this project.
And a part of the things that we were hoping to get out of this is like when we learn this, and this is how the community feels, is that even though people are charged to do their job, they don't have to do their jobs in a way that make people feel this way. That the trust is broken and that they're not human or that they don't matter. And so those are some of the solutions that we're hoping to go to.
So we look at a lot of collaboration across systems, but specifically with law enforcement. We talked about possibly bringing law enforcement into a weekly Thursday night healing circle that we host. And the concluding line of that first quote said, so adding in law enforcement to that group would feel like letting in an outsider. Things like that, where just above it, it says we're safe with the outreach workers and just the community. We feel a lot safer because this is our sacred place in these healing circles. What would introducing law enforcement look like? And can we work for a reality that's different than this? The answer is yes, and we are, and how, and to what end, and how do we know if it's effective? We talked a lot about community-based orgs, program barrier, access, connectivity, the responsibility, that bottom quote is between CBOs and law enforcement collaborating, or the city and law enforcement collaborating. Looking at city engagement, how can the city show up and support in ways that are received well, showing love. So it's interesting to think about how this might be received by individuals at the city level, boots on the streets, really showing up. And we do have a lot of that happening in the city of Denver, and I do feel fortunate for that. I think we feel fortunate for those collaborations. And we move into these indicators of healing, and these were across different systems, or the different levels, individual, environment, and systems levels. We've talked a little bit about the impact of findings on the work. I don't know if we want to spend a minute there, or if we want to open it up to questions. We always say future, in a good research study, we say future research can, and we kind of have changed it to future research should. And for us, with the plethora of projects that we have, future research will. And so stay tuned, I would say, for the next iterations of these projects. But maybe we'll go to questions. Is that where we're supposed to go right now, VP team?
Yeah, so thank you all. So we have just under a couple of minutes left. So I'll just say like, thank you for this presentation. It was really fantastic. I was really struck by the number of times that you used the term trust throughout this presentation. And it's maybe not unique to see the term trust come up in research in terms of what communities or individuals or patients sort of expect when they participate in research. But your characterization of it was entirely different in that it seemed like the trust you're referring to had to be earned trust. It wasn't some implicit trust that as a researcher I could bring to our interaction and just have assumed. So thank you for clarifying that. Mr. Williams, Ms. Green, I'm curious. So you've done a lot of work in this space, and I think there's a lot of interest in other places, other cities, in engaging people with lived experience or VPPs or whatever phrase they use to characterize their roles in those communities in research. Um, what are the tools, what are the resources you think are needed for other cities, other organizations to try and support people to engage in that research?
I think an understanding of the importance of what the research is going to end up doing. I mean, and now let me be first to say, lived experience is not enough. Just because someone's been through something does not mean they could be a researcher. Does not mean that they need to be in this work either, right? So, what other supports can you give someone that has that lived experience, that's interested in becoming a part of the healing team? And just removing the barriers. That's a part of it, because I think a lot of what we did was rebuilding trust between academic and community, and removing barriers that would have normally been in the way of those that are really interested, those that have the skill set, have the lived experience, and have the desire to do something different and move differently. I think that the other cities can recognize that, because the convenience that we've had thus far, we have cities looking at us like, what? VPPs doing research? Like, that's unheard of. Like, what are you talking about? So that's already barriers. So we're just out here trying to change the lens. We know this is not rocket science. Jenny said it earlier. This is not brand new things. If we just understand and remove the barriers and recognize the importance of it, I think that's in itself is going to be enough for the cities. And I know the other resources already exist. There are good academic partners, there are good community partners, there are good VPPs with lived experience that are ready to go if the barriers are removed.
And if we do this work, we need to control our narrative for our community. We can literally change the trajectory of our communities through research. And I think that for me, I had to heal from my trauma in regards to research first, for me to even understand the impact that we could have if we engulfed ourselves in this new way of thinking. And so one, starting with ourselves, with trusting of research and the system, and how we can be the change in research and the narrative that we need to see, and how we can control that ourselves.
I think to make this reproducible in other areas, what really has to happen is you have to have a partnership and a commitment that the research is going to be community led, not community consultation, not sort of we come up with questions and then go find out how the community feels about that. It has to be community led. And so that's what we're doing as far as not just the research aspects, but the programmatic aspects of this. Johnny's in charge. And then it has to be that way. If you want to have a model like this has got to be community led.
Thank you all. As a researcher, Ms. Green, I'll say I am wholly biased to agree with your comment, which you put beautifully. We can literally change the trajectories of our communities through research. So thank you for summing it up that way. We're at the top of the hour. I again want to thank you all for your presentation and your thoughtful discussion. We look forward to engaging you in the future. If you're not in our webinar series or not subscribed to our webinar series, please reach out and we will get you on the automated emails. Thank you all.
Thanks so much.
Thank you.